Everybody, we are a HOSA group from Newark Charter School located in Newark, Delaware, and we will be giving you a presentation about social media and anxiety. We are competing in community awareness. My name is Anna Kliwa and I am a sophomore.
My name is Margaret Liam. I am also a sophomore.
My name is Tani Rowell, and I'm a junior.
And my name is Brenna Ziegler. I'm also a junior.
So today we will be discussing social media and anxiety and their correlation. Just a content warning, we do talk of distress, mental illness, and body dysmorphia or eating disorders. This content is for educational purposes only. It is designed to provide information, not to diagnose anyone. If you have any more questions, please reach out to your healthcare provider or to other medical professionals. Again, this presentation was designed for a HOSA competition. The intent is to inform students and to spread awareness in our community.
So by this point, you should have completed the pretest, or you should be completing the pretest. It is linked below. Please do not worry if you do not get all the answers correct, because throughout the presentation, the answers will become more and more clear. During our presentation today, we will be focusing on the correlation between social media and anxiety in teenagers. During the pandemic, anxiety and stress levels have risen, and due to that, people have started to spend more and more time on social media. Its impacts have been reflected in many anxiety patients. However, social media can also be a beneficial tool, and we will highlight that in the slideshow. Anxiety is very common in teenagers, and the percentages have been rising annually.
I would like to go over the difference between mental health and mental illness because a lot of people use the terms interchangeably when in reality they are quite different. Mental health is something that everyone has. It's just like your physical health. It is your overall mental well-being, which can include emotions, thoughts and feelings, problem-solving skills, and social connections. There are different degrees of mental health, and everyone has bad days, but it doesn't necessarily mean that you have a mental illness. It just means that day that your mental health is bad. Mental health is a spectrum ranging from poor to good, and it is something that is really important to take care of. Mental illnesses, on the other hand, can affect many things, including the way people think, their behavior, their feelings, and their interactions with others. The major types of mental illness are depression, anxiety, mood disorders, including bipolar, personality disorders, schizophrenia, trauma disorders, eating disorders, and addictive behaviors. These can be caused by biological factors, but there are other things that can contribute to it as well.
The first topic that's being discussed is how the pandemic has affected mental health. During this time, people's mental health has decreased as stress has increased. Examples of common stressors include social media, online school, work, and many other reasons. In the past year, it's been advised to stay inside and quarantine for safety reasons. With the recent switch to all virtual learning and working at home, it's been difficult to adjust from our old way of life to this new reality. The isolation away from family, friends, and loved ones can deteriorate mental health. But despite all of this, it has been found that good ways to cope include exercising and going outside frequently, video calling with friends and family, and making time for self-care. These are all essential in maintaining a healthy mental state. It has also been found that teletherapy, which is virtual therapy and counseling, can be very beneficial and has actually become more popular during this time. But in order to stay healthy during this pandemic, it is important to be educated about different types of mental illnesses. A way for you to become educated is understanding the signs in order to help a family member or friend who may be in need.
To start our discussion about social media, I want to talk about the negative aspects of using social media. This can include the fact that friendships built entirely on social media may be weaker than in-person ones because there's no human connection and it's not happening face to face. And these friendships are often less reliable in the future. Social media can make people long for things that they don't have, that they would see other people have on their social media. And it can also create standards for beauty, which can lead users to have negative body images and then body dysmorphia and eating disorders. The overuse of social media may worsen mental health. People tend to go to social media as a way to avoid problems in their real life, and then they don't address those problems and they become even worse. And then once their problems become even worse, they go back to social media, making this a very problematic cycle. The overuse of social media can increase stress if people feel the need to keep up with things online, if they feel like they need to keep posting things for their followers or keep keep up to date with what their favorite influencer is doing. Staying up late on social media can cause sleep problems for many people. And social media can also increase anxiety through what it displays and through social situations it creates. That being said, it is just as important to talk about the benefits of social media. This includes the fact that social media can help people initiate and establish social connections around the world, which they would not be able to get in normal situations. It may be easier for some people to socialize without leaving the comfort of their own home, and they can form friendships where they feel like they have more power because they're in a situation which they are comfortable with. On social media, people can find support from communities of all kinds where they can develop new things and share beliefs and learn all kinds of cool things from different communities. Social media contains space to share your creativity and new ideas, and you can also hear new ideas from other people and learn their creativity and see what they can do. On social media, people can learn about new cultural, political, and social ideas that they might not get access to other places. Social media can make people feel less isolated, especially like now, as Brenna mentioned, when we're all at home and we don't have the time or we don't have the chance to see other people. Social media can help us do that. Social media can also help us develop new skills, become more independent, which is very helpful for the future. And social media can encourage people with anxiety in particular to reach out more and create a better environment for themselves.
So we have included a quote from Amy Jo Martin, who is an American author, speaker, entrepreneur, founder, and the CEO of Digital Royalty. The quote says, "It's a dialogue, not a monologue, and some people don't understand that. Social media is more like a telephone than a television." This quote really shows how social media, when used properly, is beneficial.
We're now going to discuss some of the causes for anxiety. Before we begin, it's important to know that there is not one single cause for anxiety, as there are a variety of reasons depending on a person's specific situation. Today, I'm going to discuss the 4 main causes. The first cause is about family history. Anxiety can be caused by genetic predisposition, which can be passed down through generations. But it's also important to understand that anxiety is by no means guaranteed if a family member has it. This can be a cause, but it does not occur in every situation. There's still lots of research occurring about genetic predisposition, and it's believed that if it does not run in the family, it can be caused by a social environment. This brings us to our second cause, which is personality. To be more specific, it's due to traits that a person possesses. These traits include being a perfectionist, being timid, lacking self-esteem, and being considered controlling. This can occur at any age, and these specific traits can cause anxiety. The third reason is a personal experience that may have occurred. This can include things such as work stress, moving homes, family or relationship issues, a death or loss, and several other reasons that are not listed. These experiences can take a toll on a person, which can lead to anxiety. The final cause that we would like to bring light to is physical health. This includes things such as pregnancy or postpartum, and verbal, sexual, or physical abuse trauma. Anxiety can also be brought about by other disorders and illnesses, which can be chronic or autoimmune. It is important to understand that anxiety can be brought about by events, experiences, or encounters. As mentioned before, there is no single cause for anxiety. As we'll discuss later in this presentation, there are varying levels of anxiety in different forms as well, and this information can be determined by the person and their individual situation.
This graphic shows that 7.1% of kids ages 3 to 17 have diagnosed anxiety. As you can see in the graphic behind, the older that this child gets, the more likely they are to have anxiety, meaning that kids, especially in their teens, have anxiety. There are 6 recognized types of anxiety, and usually they are diagnosed when a person has symptoms for at least over a month. The first is generalized anxiety disorder, or GAD, when a person feels anxious on most days, worries about a lot of different things, and this happens for a period of 6 months or more. Social anxiety is when a person has an intense fear of being criticized, embarrassed, or humiliated, even in everyday situations, such as speaking publicly, eating in public, being assertive at work, or even making small talk. Specific phobias are when a person feels very fearful about a particular object or situation and may go to great lengths to avoid it. For example, having an injection or traveling on a plane. There are many different types of phobias. Panic disorder is when a person has panic attacks, which are intense, overwhelming, and often uncontrollable feelings of anxiety combined with a range of physical symptoms. Someone having a panic attack may experience shortness of breath, chest pain, dizziness, and excessive perspiration. Sometimes people experiencing a panic attack believe that they are having a heart attack. Obsessive compulsive disorder is one of the types of anxiety where it is present. OCD is when a person has ongoing or unwanted and intrusive thoughts and fears that cause anxiety. Although the person may acknowledge these thoughts as silly, they often try to relieve their anxiety by carrying out certain behaviors or rituals. For example, a fear of germs and contamination can lead to constant washing of hands and clothes. Post-traumatic stress disorder, or PTSD, can happen after a person experiences a traumatic event, for example, war, assault, an accident, or a disaster. Symptoms can include difficulty relaxing, upsetting dreams or flashbacks of the event, and avoidance of anything related to the event.
Here are some symptoms of anxiety that are very common. To start with, we have excessive worrying, and now this occurs in response to normal situations. So, for example, if a person is flying on a plane for the first time and they're feeling very worried, that is reasonable because it's a new experience and it's something they're not used to. However, if someone else is getting on the bus to go to school, and they've been going on the same bus for many years and they're comfortable with the people on it, but still they get very anxious and worried before they get on the bus, that might be a symptom of anxiety. Another symptom is feeling agitated, having a rapid heartbeat, sweating. People might be shaking, or they could have a dry mouth. Restlessness, if going along with feeling agitated, they're uncomfortable and they just don't know what to do with themselves. Fatigue. People with anxiety might have difficulty concentrating on everyday tasks, their work, or just watching, just having a conversation. Muscle tension, another symptom could be trouble sleeping. And again, this is consistently, like on a set over a month, usually, and not just like something happens and they can't sleep. But if they're finding themselves staying awake every night, thinking about something or worrying about something, that could be a symptom of anxiety. Avoiding social situations, even if it's with people that they know, and irrational fears, as Anna mentioned. Reaching out for anxiety. If you feel out of sorts in any way at all, even if you have any of these symptoms I listed or none of them, but you just don't feel like you should, it's important to know that you can get help. You can talk to a doctor or a therapist, or even just someone you trust. If you're a parent, make sure to check in with your child and see how they're feeling, and if they're not acting like themselves, ask them if anything's going on and see what you can do to help. Reach out to your friends to make sure they're okay, particularly during these times. People can feel very isolated when we can't see each other and we're lacking this human connection. So it's really important to remember to stay connected. And again, we want to remind you that this is not a diagnosis of anxiety. So you might find yourself agreeing with some of these symptoms, but please do not self-diagnose. If you feel like you need to, definitely reach out to a medical professional.
Recent studies have shown that over 50% of those with a mental illness either go undiagnosed or do not get the proper help they need. This can be a cause of people not seeking help, and therefore it's very important that you seek assistance from a professional if you feel that yourself, a friend, or a family member are showing symptoms of a mental illness. But once again, as Maggie stated, please do not self-diagnose without consulting your health professional first.
So there are many treatments and resources for anxiety. Treatments can include counseling or therapy, meditation and relaxation, as well as even prescription drugs. There are also many ways to cope with anxiety, which include fidgeting toys, breathing patterns, exercise and better quality sleep, as well as lower caffeine intake and eating healthier. There are also many organizations that can assist with mental health issues, such as the Substance Abuse and Mental Health Services Administration, the Anxiety and Depression Association of America, the American Counseling Association, the National Institute of Mental Health, the National Alliance on Mental Illness, as well as the local Delaware Hope. We have provided the contact numbers and website links for all of these organizations.
Thank you so much for listening to our presentation. And if you would like to contact us with any questions, we have our Instagram and our emails listed. And please do not forget to take our post test. It is also linked in the description right below.